Tenivac Vial is a vaccine used to prevent tetanus and diphtheria in both children and adults. These bacterial infections can lead to serious and potentially fatal health issues such as heart problems, nerve problems, and muscle paralysis. By getting vaccinated, the body is able to create its own protection against these life-threatening diseases. It is recommended for all individuals who are 7 years of age and older. However, it should not be used in children younger than 7 years, as they may not be fully protected by this vaccine. If you have a child younger than 7 years, consult their healthcare professional for more information on the available vaccine for younger children. Before receiving the Tenivac Vial vaccine, make sure to read the vaccine information statement from your healthcare professional. This vaccine is administered by injection into the muscle of the upper arm by a healthcare professional. It is usually given in a series of doses to provide the best protection, so it is important to closely follow the vaccination schedule provided by your healthcare professional and keep all scheduled medical appointments. Based on your age, vaccination history, and previous reaction to vaccines, your healthcare professional will determine which vaccines are best for you. Be sure to discuss the risks and benefits of vaccination with your healthcare professional. After getting the Tenivac Vial injection, you may experience pain, redness, warmth, bruising, or swelling at the injection site, as well as tiredness, fever, or headache. If any of these effects persist or worsen, it's important to notify your healthcare professional promptly. Rarely, some individuals may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears immediately after receiving the vaccine injection. If you experience any of these symptoms, it's important to inform your healthcare professional right away. Sitting or lying down may help, as these symptoms typically do not last long. It's important to remember that this medication has been prescribed because the healthcare professional has determined that the benefit to you or your child outweighs the risk of potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your healthcare professional immediately if you or your child experience any serious side effects, such as shoulder pain, muscle weakness, or numbness/tingling. While a severe reaction at the injection site is rare, it is important to notify your healthcare professional if you or your child develop any of the following injection site reactions: a persistent lump, severe pain, or a large area of swelling/redness/bruising. Although a very serious allergic reaction to this drug is rare, if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing, it is crucial to seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed above, it's important to contact your healthcare professional for further guidance. If you are in the U.S., you may report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967. In Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before receiving Tenivac Vial, make sure to inform your healthcare provider if you have any allergies, especially to vaccines, or if you have any other allergies. This vaccine may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Also, be sure to inform your healthcare provider about your medical history, especially if you currently have a fever or illness, Guillain-Barré syndrome, or immune system disorders such as HIV infection or certain cancers. If you are pregnant, this vaccine should only be used when absolutely necessary. It's important to weigh the risks and benefits with your healthcare provider. If you are breastfeeding, it is unclear whether this vaccine passes into breast milk, so it's important to consult your healthcare provider before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare professional. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Tenivac Vial include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. It's also worth noting that other vaccines may be given at the same time as Tenivac Vial, but they should be administered with separate syringes and at different injection sites. As for the optimal timing and dosage of Tenivac Vial, be sure to follow your healthcare professional's recommendations for the best results. This vaccine is used to prevent tetanus in people who have experienced a severe injury or wound, especially if it has been contaminated with dirt or other foreign substances. It is also used as a booster vaccine for adults and children who have already been vaccinated against tetanus. Just like any other vaccine, Tenivac Vial may not provide complete protection to everyone who gets it. It's important to keep a record of the vaccine for yourself and your children. When your children are older, make sure to give them and their healthcare providers the vaccine records to avoid unnecessary revaccinations. Be sure to ask your healthcare professional about when the next dose of Tenivac Vial should be administered. It's important to stay on schedule with vaccinations, so consider marking your calendar to remind you. If you miss a dose, contact your healthcare professional to reschedule promptly. Remember to store Tenivac Vial in the refrigerator, but don't freeze it. Keep it out of reach of children and pets. When it's expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.